Philip Muccio is president and founder of AxioBionics, where he directs the pain management and neuro rehab divisions. Philip discusses electrical stimulation and the benefits of wearable therapy with Dr. Carl Hasselman.
We're very, very early on in medicine in electrical stimulation. There's no question in my mind. It's going to be a huge area. I think pain medication is not the right answer. It's kind of like throwing sawdust on a fire. It really doesn't help. You really have to extinguish the fire with water. And so we know that most pain pathways are electrical in nature. I mean, it's the human nervous system. And yet we use narcotic medications just to take the edge off, but it really doesn't address the primary problem, which is the electrical problem. Our motto is, above all, do no harm as physicians. And if you're doing medications or invasive procedures, there are the risks for harm.
While Mike is back to enjoying time with his family, this was interrupted with a decade of pain, which was extremely debilitating. Mike suffered from chronic pain for an initial 5 years from a work-related accident. Mike's pain, an 8 on a scale of 10, recurring infections, and multiple limb salvaging surgeries resulted in a transtibial amputation in the fall of 2005. Mike endured a different kind of pain for the following 5 years. Residual limb pain, a condition which occurs in approximately 74% of amputees.
I have better balance. I can go up and down steps. I can do whatever I want to do. The muscle tone's there, no pain, good circulation in my leg.
The amazing outcome of wearable therapy is that it combines muscle stimulation with the concept of blocking pain, and it addresses the absolute link between muscle atrophy, pain, and dysfunction.
I start at 5:30 in the morning, go till 10 o'clock at night, with never taking it off, unless I go in the pool, and then I have my aqua leg.
Mike's decade of pain ended in just under 30 days of use with wearable therapy. Like so many wearable therapy patients, this innovative technology has given Mike hope and a new lease on life. Many suffering from chronic low back pain have received great relief with the use of wearable therapy.
How you doing, Ben?
Good.
It's good to see you.
Likewise. The low back pain, unless I actively do something I probably shouldn't and know better that I shouldn't do, back pain's virtually non-existent. It's a huge change.
Without the use of wearable therapy, Ben suffered from bilateral sciatica pain for 6 years. The wearable nature of Ben's BioShorts allows more pain therapy time, greater productivity, and a reduction in pain medication.
What did you think to yourself, when you saw this come down the pike?
Ben and Mike are just two great examples of how this technology worked when everything else in the medical profession failed. These are not people who last week sprained their ankle and have a little bit of pain the next week. These are people who have lived with it for years. They have been to multiple doctors. They've tried multiple medications. They've been through multiple physical therapists, and each time they get their hopes up, and it doesn't work. One of the most frustrating patients for the doctor as well as the patient is the chronic pain patient. There's no question. Every physician feels frustrated with the chronic pain patient because we can't control their pain. As you know, we give somebody pain medication for low back pain. Well, all medications over time, the human body's smart enough to develop a tolerance. The body figures out chemically a way to get around the medication. And the neat thing about electrical stimulation is that your body really can't adjust to it. It really never quite adjusts to it. And that really doesn't want to because it's a natural, that's how our brain talks to our muscles, with electricity. And so we're just using what the body does to talk to it, whereas medications, you're blocking the normal pathways that our body uses. If you can control the chronic pain patient with a therapy as simple as this, I mean, you really, to me, it's Nobel Prize material.
We oftentimes hear patients say, well, I'm not quite sure why I was prescribed an antidepressant, because I'm really not depressed. I'm really just suffering from the effects of pain, and if you can get rid of the pain, I won't be depressed. So prescribing an antidepressant might be one solution, but it's certainly not the best solution. I mean, I think getting rid of the pain is the solution.
Chiropractic care is hit or miss. Again, though, if you think about what a lot of chiropractors use, exercise and electrical stimulation. And so, I mean, they're doing that. We've never really married the two. This technology obviously marries the two. And if we can effectively control pain, like in Ben's case, just think about it, how much money we've saved by not going to chiropractic visits regularly, not going to physical therapy regularly, not taking pain pills on a daily basis. Medications alone can be incredibly expensive and not very effective. There really has never been shown a medical study that shows an effective treatment for chronic low back pain.
The medical profession really cannot come to the table with an effective solution for it. It kind of blows my mind knowing that in this century that we cannot control pain, not just low back pain, but many times we cannot control pain other areas of the body. And so it's still a very elusive type of problem we have in the medical field. And my experience with electric stim is really quite phenomenal. It can address pain very quickly. I mean, within 10 to 15 minutes.
To control and treat chronic back pain and or chronic extremity pain is, as I said to you, it is Nobel Prize material because nobody has been able to successfully do it at all, period. That's all there is to it. If they have, they have it kept secret because I can tell you, I read literature all the time and there's nothing out there. You're going to change the way orthopedics practices. I think that every surgeon would welcome and gladly welcome this technology.
For us as a company, we really work towards getting the system wearable.